Nice. All right. So welcome everyone. This is going to be a dose calc webinar. This is my third or fourth one I think I've done for Archer Review for nursing. My name's Brandon Kraft. If you have not attended one of these dose calc webinars, I've been a math instructor for about 20 years. About a decade ago, I started doing T's math, and then that led into dosage calculations, which is perfect because a lot of T students or even HESI students, they take the T's or the HESI, they pass it, they get into nursing school, and then you have dose calc, which is one of my favorite things to teach actually, because a lot of math, you can do it so many different ways, and it does apply to dosage calculations as well. But I actually love one technique, and it's pretty much the only way I teach it. I do show shortcuts every now and then, but dimensional analysis is my best friend. And I have worked with so many students. They first come to me, they're like, man, I hate it. I don't like dimensional analysis. And within an hour, I can convert quite a few of them to actually end up liking it because you don't have to memorize formulas. And if you've got this idea of formulas in your head, today we're going to quickly see that formulas are not always going to work. They're very limited. And if you try to, memorize a formula for this one and then a formula for this one and then a formula for this one, you're just going to end up trying to remember too many. But what you do have to memorize is you have to memorize your conversions. You got to know your conversions for dose count. There's no way around that, but we can tie those directly into our dimensional analysis. I'm just checking over everything. And I'm just going to go ahead and slide on through a few of these real quick. Now, Archer Nursing School, over 20 courses. I personally did the dose calc course myself. There's question banks with every single course. If you want to scan that QR code, or heck, just head over to Google and type in Archer Review Nursing School, and it'll take you right to it. There's 20 courses. You can do it a la carte. You can pick whatever you want, check out, and start learning. And it's a great companion to nursing school. Now, me personally, the only thing I know about nursing really is dosage calculations. I can tell you how many milliliters to give a client or a patient, but you don't want me giving it to a client or a patient, especially if it involves needles. But I can do the math right here with you, and that's what I'm here for today. So with that, we also have private tutoring. This QR code here, you could probably Google Archer Review Nursing School tutoring. Personally, I do dose calc. If some of you here are actually TEAS test prep takers, because I am connected to the TEAS Facebook group as well, it looks like. Yep. I do tutoring for T's, I do tutoring for HESI, I do tutoring for dosage calculations as well. So you can follow that QR code right there. And this actually has a list of all of our nursing tutors, not for just math, but all of your all of the nursing stuff that you need. We have pretty much a tutor for every topic. Now, what I like to do and what I've started doing recently is a giveaway. So to kind of motivate you to stay for the whole webinar, it's going to be about an hour. I do a giveaway. I will give away one free hour of tutoring, but you have to hang out and stay until the end. So how do you enter? You're going to have to wait. It's pretty easy to enter, but you got to wait until the end of the webinar. I will pick a random person, or I'll let the computer pick a random person, and you'll know that before you leave today, before you leave today's webinar. And if at any point you got any questions, I'm going to try to follow some of the chat. Some of them I'm not going to be able to follow because, heck, what do we got? I don't know. I don't know how many people we got watching or whatever. I'm probably a couple of hundred. I'm not sure. But to dive into today's webinar, weight-based medications. And maybe you have seen this, ran across this, kind of a quick overview of some things that we are going to look at is milligrams per kilogram or micrograms per kilogram. But very often when you're dealing with a client, medication is based on their weight. For example, take me, I would take more Tylenol or Advil than my 10-year-old son because I weigh more than he does. But that applies to a lot of medications in healthcare. And not only does it apply to milligrams per kilogram or micrograms per kilogram, but it also depends on how much per day or how much per dose. And we have to look out for those words when we're doing our dimensional analysis. Now, later on in the future, I will be doing an entire webinar on safe dose. Safe dose does involve weight base, but it takes it one step further in that you have to typically find a minimum value and a maximum value. And you, as the provider, you want to stay within that range. But that's one topic in and of itself. Today, I'm really going to focus on, things like this right here. Now, with that said, something I have noticed over the many years that I've worked with nursing students is the rounding. Rounding rules do vary from nursing school to nursing school, program to program. So, get your cheat sheet from your nursing program. What do we need to round to? That's what you need to be asking your nursing instructors. Very often for pediatrics, it might be the nearest hundredth or the nearest tenth for certain things. But for today's purposes, I will tell you what to round to in the examples that we work out. Now, something else to mention, and my co-host here probably can answer some questions about this, but here it is what? The first week of May. In June, and I just realized my camera was off on Zoom. Shame on me. I had it on socials, but probably around the first week of June, I'm going to be doing either a 1 hour, 2 hour webinar, and it's going to be on distractors. But this is going to be instead of it being a free webinar like today, it's going to be a paid one, but we will jump straight into doing math. You're not going to hear me blabber on about the tutoring and all the stuff that we have to offer at Archer. That webinar, you jump right in, and within the first 2 minutes, we're going to be hashing out some math problems for dose calc. And those problems are what I call distractors. Distractors, you're going to see some today possibly where there's numbers all over the place and you might not always use all of the numbers in your problem. That's why I call them distractors. Very often you'll have some numbers there that are simply there to distract you. You will not use them in your calculation. And that is going to be an entire 1 hour or 2 hour. It's not fully planned yet, but be on the lookout for it first week of June. And yeah, I'm excited about that one. So, any other questions? We'll follow over to a few things. Yeah, let me know where are some of y'all located? I'm curious. Are we all in nursing school? Are we prepping for T's? Are we prepping for NCLEX? NCLEX. I'm just curious to see because most of the webinars I do are for T's math, and those students aren't in nursing school yet. NCLEX from Canada, prepping for NCLEX, 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 NCLEX. Well, my co-host can probably comment on this more than I can, but the good news probably for some of you is that, to my understanding, I don't think dose calc is quite as crazy as it used to be on NCLEX. I'm not an expert on NCLEX, y'all. I am a math nerd to the core, but I have heard that it's not quite as crazy as what it used to be. But if you're in nursing school, dose calc, we all know that the testing requirements are very strict. You may have 20 questions. You can only get one or two wrong, and you got to do that in order to move on in your program. So, with that said, I'm ready to get started. Now, go ahead, grab you a notebook if you want, grab a calculator because I'm going to show you a fantastic calculator shortcut to handle the craziest dose calc problems. And we're going to see some crazy ones today, I promise you. So, with that said, and I do see some of you mentioning, dose calculations, math is One of your struggles, I hear that quite often. 20 years as an educator, you better believe I do hear that quite often. So, dimensional analysis is one technique. Now, I did mention that I will show you some shortcuts. Now, what I'm going to go ahead and throw out there is if you know when to multiply versus when to divide, by all means do so. But trust me, these problems are going to get crazy. I got 5 problems for us today. Here's our first one. To treat an infection, a prescriber has ordered this drug, this medication, at a dosage of 3 milligrams per kilogram for a client weighing 84 kilograms. Now, our question is, how many milligrams should the client receive? This, some of you probably already know what to do without worrying about a formula or dimensional analysis. The shortcut, and I'm going to explain why this works, but the shortcut here is to take that 3 milligrams for each kilogram. That's what that means right there, y'all. That means 3 milligrams for each kilogram that that client weighs. So if that client weighs 84 kilograms, we need 3 milligrams for each of these 84. That's an indicator that we do need to multiply, and our answer here is going to be the area code where I live, 252, 252 milligrams. But I want to go ahead and motivate the idea of dimensional analysis to you. So I teach it. If you've attended any of my dose count webinars in the past, it's almost like I'm a broken record, but I still love talking about it. I still love teaching it. What I tell students to do with dose count is very often you can skip over the junk in your problem and look straight at your question. And there's a reason. And you're going to see this. This is going to help us do crazier problems later today. Trust me. Our question says, how many milligrams should the client receive? It doesn't mention per dose or per day, but I like to call this our goal. Our goal is how many milligrams will the client receive? And this is how we start our dimensional analysis. Now, again, I understand the answer is 252, but I want to build up to these crazy problems, and I want to show you the concept of dimensional analysis with these quicker ones first before we move on to the crazy ones. So, our question again, how many milligrams should the client receive? Our goal is milligrams, so I'm going to write down a fraction, and I'm going to put that word milligrams at the top. Put it at the top of your first fraction. There are other ways of doing this, but y'all, I bet you've asked yourself before, how do I get started? How do I start these problems? That's what I'm trying to show you right now. I'm trying to show you how you can start pretty much every single dose count problem that you run across. Look at your goal. Our goal is milligrams, so I'm going to start off with milligrams at the top of my first fraction. I'm going to say that over and over today. Look at your goal. Start off your first fraction. So our goal is milligrams. Now let's look back at our problem and let's look for this word in our problem. And the only time I see milligrams getting mentioned in this problem is right here. 3 milligrams per kilogram. So I'm going to write down 3 milligrams per kilogram. All right, what have we accomplished? We looked at the question. We established our goal. Our goal was milligrams. We wrote milligrams at the top of our first fraction. We look back at our problem and we find that word. And then I'm creating that fraction. Now, which one of these words do we not want? Our question says, how many milligrams? So we want to keep milligrams in our dimensional analysis, but we don't want kilograms. We want to get rid of this word. And to get rid of a word in your dimensional analysis, kilograms is at the bottom. I'm going to throw kilograms at the top. And again, We want to get rid of this because the question is not asking about kilograms. We got to get rid of that kilogram. And in our problem, it mentions 84 kilograms. And I'm going to put this over 1. Does anybody know what the 1 truly represents? The 1 actually represents the 1 client. It has a meaning to it. That 1 that I'm putting at the bottom has a meaning. It means the 1 client. But really, I'm just going to leave that word client or patient off. Notice I am canceling the word kilograms. And all we're doing is multiplying these two top numbers. 3 times 84 is 252, and there's nothing to divide by. This is an understood 1. This is the 1 client. If you take 3 times 84 and you divide by 1, that's not going to change anything. It's still going to be 252. So, and again, this may seem like overkill, but trust me, within the next 45 minutes, you're going to see how canceling these words out really is an organized process with dimensional analysis. Now, if y'all could let me know if the audio is, I heard or heard, I saw what one person said that the audio was too low. Just let me know. I'll try to talk into the mic a little bit more. But let's go ahead and bump up the difficulty a little bit. And let's look at an example where we actually have two different questions. And it goes back to the beginning of the webinar where I mentioned dose versus day. We have to be careful and make sure we pay attention to whether it's dose or day. So I'm going to skip all of that for right now. And I'm going to jump to my first question. Question A. Remember what I said. These problems are going to get longer and longer and longer. So let me go ahead and show you how I do every single dose calc problem that I pretty much run across. I immediately skip all the junk at the top and I find my question. I establish my goal. And the goal here is how many milligrams per day. That is important. How many milligrams per day? Now, a while ago, in the previous example, it didn't mention day or dose, but this one does. How many milligrams per day? So now we have two words in our dimensional analysis. We have milligrams at the top, we have day at the bottom. What we're going to do is we're going to focus on this top word first. And this is actually, if we look back up here now, milligrams, we want to look back at our problem and find something that we know about milligrams. And it mentions it right there. 5 milligrams per kilogram per day. Now watch how I'm going to write this down in my dimensional analysis. I call this the double slash because there's two slashes. And I'm sure you've seen this pop up in quite a few problems in your dose calc classes where weight base, I call these the double slash. Watch how I'm going to write this down. I'm going to put the 5 with the milligram because that's what it says. And the kilogram and the day, whatever two words are in the double slash after this milligram, or it might be microgram, whatever these two words are, I'm going to keep them together and I'm going to stick those two at the bottom. And you might say, why can we do this? I could really sit here and explain why we do it. I'm just going to say, technically speaking, you are dividing by fractions and there's this thing called keep, change, flip. You've probably heard of multiplying by the reciprocal. Don't stress about it. Double slash milligrams per kilogram per day. I've got milligrams at the top and I'm putting these two words at the bottom. So why am I doing this? Goal was milligrams per day. Notice we do have milligrams. And hey, it just so happens that we have the word day right here as well, but we still need to get rid of kilogram here. Now, I know what some of you are going to do, and technically it's okay, but I don't like to touch my calculator until I'm done. I don't touch my calculator until I'm done with all of my dimensional analysis. But I know some of y'all are probably going or probably already have grabbed your calculator and taken that client's weight and divided by 2.2. And technically this is okay, but notice we have an ugly decimal. I don't like to use funky decimals in my calculation. I only want to see funky decimals one time, and that is when I get to my final answer. So, in some programs, they will tell you that. They will say, do not round until the end. So, I don't want to use this. Let's bring in some conversions. Watch what I'm going to do here. We need to get rid of this word kilogram. We want to keep milligram and day. So, to get rid of the word kilogram, I'm going to stick it at the top. But notice we don't have the word kilogram up here. We have the word pounds. This is where we're not doing math. I'm not going to do any math yet, y'all. This is where we're going to put the conversion into our dimensional analysis, and we'll worry about the math later. What is that conversion, y'all? Tell me if this conversion is right. Is this conversion correct? 2.2 kilograms equals 1 pound. That conversion is not correct. 1 kilogram is equal to 2.2 pounds. That's the correct conversion. The 1 goes with the kilograms. The 2.2 goes with the pounds. Kilograms cancel out. Notice I have not touched my calculator. I don't touch my calculator until I've met this goal. I promise you this always works. You never touch your calculator until you've met your goal. We need to get rid of pounds now, and we can tie in the client's weight. Now, where does that 164 pounds go? We need to put pounds at the top so that we can cancel out with pounds at the bottom. And that's the name of the game with dimensional analysis. It's all about getting rid of words that are not in your goal. That is what dimensional analysis really is all about. So this 164 pounds represents that one client. We're going to cancel out pounds and look at your dimensional analysis, y'all. What words do you have left? What words have we not crossed out? Milligrams. That's the only word we have left at the top. The only word we have left at the bottom is day. Boom, we've met our goal. And you can do this every time. The problems are going to get crazier. Just wait. Just wait. Some of y'all probably did this one without doing dimensional analysis. There's a good chance that there's some coming up that you're not going to know when to multiply and divide automatically. I got some coming. So what do we do from here? We finally met our goal. Here comes my calculator shortcut for you. We're going to see a bunch of crazy ones right here in a little while. But what you do is you multiply all of your top numbers. Most of you probably press equals after this, but you don't have to. You multiply all of your top numbers and you divide by all of your bottom numbers. But you can always skip your ones. I can skip that one. 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 You can skip ones in all of your dimensional analysis when you go to type it in. So with that said, listen, what did I say now? Multiply your top numbers. 5 times 164. You don't have to press equals. Immediately divide by your bottom numbers. And the only bottom number we have right now is 2.2. And what I want you to notice here is that, yes, we do get a funky decimal, but that funky decimal only pops up in our final answer. Our final answer. I did not do any rounding until the very end. Now, it does say to round to the nearest tenth. So understanding our tenths place, let me see here. That's going to be the first spot to the right of the decimal. So therefore we have 300, that's ugly, 372.7. And it's what? Is this $372.70? No, we got to put our units in here. It's 372.7 milligrams per day. We've met our goal. We've multiplied all the top numbers. We've divided all of our bottom numbers. Now, let's take this one step further. Let me duplicate this page and I'm going to erase this part. I'm going to erase this part. And if I need to jump back to a slide, just let me know. I still got it right there, but I'm just going to notice here, I'm going to do B because there is a slight difference with B, but I'm still going to recycle some of the work we've already done. So we're working on question B now. And what is our goal for question B? Again, let's act like we haven't seen any of this junk. Let's act like we haven't seen any of this. Skip all your stuff. Read the question. The question says, how many milligrams per dose? Milligrams per dose. So how would we start this off? The same way we did the last problem. We would look back at our problem. We need milligrams. So yes, I'm still going to use the 5 milligrams per kilogram per day because that's what's in our problem. So again, that's why I'm recycling some of the stuff. Now, we need milligrams per dose. Right now, when we got rid of the kilograms a while ago, we let day hang out. I'm going to talk about how we handle that right here in a second. But just like in the previous example, I'm going to get rid of kilograms. I'm going to get rid of those pounds. And you might say, well, what are we doing different? We haven't met our goal yet, y'all. We got to meet our goal. Meet our goal before we ever type anything into the calculator. So what do we need to do to meet our goal? To meet our goal, what we need to do is we need to get the word dose at the bottom. Right now, we have the word day at the bottom. Now, some of y'all may just know to divide by 3. Totally fine. But watch how the dimensional analysis actually does it for you. If you get confused on should I be multiplying by 3, should I be dividing by 3, dimensional analysis will put the numbers in the right spot. You might say, how? Well, y'all, what word do we need to get rid of down here? We need to get rid of the word day because we don't want day at the bottom. So to get rid of a word, I'm going to put the word day at the top. And I never said that these things had to be beside each other. Never said that. I said, if you want to get rid of a word, since this one's at the bottom, as long as you put that same word at the top, you can get rid of them. And watch how I'm going to tie this in 3 divided doses. Do not put the 3 up here. Heck no. It's not 3 days. What this is saying, when you get it in 3 divided doses, this means each one day, every day, each one day, you're going to get, or the client's going to get 3 doses. That's what this means. Each day, they're going to get 3 doses. Now, our word day cancels out. Have we met our goal? Have we met our goal? Milligram, that's the only word I see at the top. Dose, that's the only word I see at the bottom. I don't know if you can quite see that, but yes, we've met our goal. So how do we finish this off? What do we do? When we've met our goal, that's the only time I come over here and grab this calculator. And what did I say do? Multiply all the top numbers, divide by all of your bottom numbers, and you only have to press equals 1 time. That is what's cool about this calculator tip. Multiply all your top stuff, divide by all your bottom stuff, and watch, I'm going to press equals once. top numbers, 5 times 164. Don't press equals. You can, but I'm not. Immediately divide. We have a 2.2. I'm not going to press equals. I'm going to divide again because there's another number at the bottom. There's a 3. And now I'm going to press equals one time. And I mean, let's look at this. Let's look at what I typed into the calculator. I promise you this will always work. And if you've never seen this technique of multiplying all the top numbers, dividing all the bottom numbers, it can be a game changer because you don't have to write down or remember what the top stuff and the bottom stuff is. You type the whole daggone thing in at one time. Multiply all your top numbers, divide by all of your bottom numbers, press equals one time. Round to the nearest tenth. That 2 stays the same because that 4 tells it to. So 124.2, and that's going to be milligrams per dose. Let me know, have you seen that technique before of multiplying all the top numbers and dividing by all the bottom numbers? I do recognize some names in here too. All right. So two different questions there. That's me emphasizing be careful with, oops, and I mean, this is not a typo. I just never came down here and addressed question B where we needed milligrams per dose. And that's what we did here. So probably the next question, I think the last three questions, if you can get all of these right without doing dimensional analysis, that's pretty good. Now, these are going to be crazy because there's just going to be so much going on here. So let's look at this problem. I'm going to skip over all the junk. I'm telling you, you might say, man, what are you doing? I told you, skip over all that junk at the beginning. Go ahead and establish your goal. So our goal here is how many milliliters will the client receive each day? How many milliliters will the client receive per day? So what I'm going to have to do here is, I think I can make this a little bit smaller just so I can fit and write everything down on the screen. So goal is how many milliliters per day? I did not have to see any of this stuff. I didn't even need to see the drug label to get started. Question I get from students: how do I get started? This is what I'm trying to show you. This is a way that you can always get started. Read your question, establish your goal. That's what I do every time when I'm teaching this to students. So goal is milliliters per day. Milliliters, that's going to be our top word. So I'm going to put milliliters at the top. It's not milligrams or whatever those other things we had. This is milliliters. Y'all, I'm telling you, it works for all of these. I mean, milliliters per hour, drops per minute, all that stuff. We can do the same technique. So from here, milliliters. We need to put milliliters at the top of our first fraction, and we're going to have to be patient and wait on this word day. Now, do y'all see milliliters anywhere up here? I sure don't. Well, let's look at our drug label. And this may kind of feel like a distractor to you, but right there, I see 100 milliliters. That is a distractor. That tells you how much is in that container. I don't know if it's a vial or whatever it may be, but that 100 milliliters tells you the total volume. What we need to use is one of these two up here. And it doesn't matter which one you use. Take my word for it. I'll come back at the end of this problem and I'll show you why it doesn't matter which one you use. I promise. I'm just going to use the first one. It's the bigger one. My eyeballs or can't read that tiny fine print, that thin font. I'm going to use this big one with the bold letters. I promise you, you can use either one though. So we need milliliters at the top of our first fraction. 5 mLs. Do not put the 100. Don't put the 100 up there. The 5 is with the milliliters. 5 milliliters, and I'm going to put that over 100 micrograms. And let's stop right there for a second because you may be saying, that's not what that says. Yes, it does. I know, I understand. I flipped the fraction. Why did I flip it? We need milliliters at the top of our fraction. That is our goal. Our goal must have milliliters at the top. That's why I wrote the 5 mLs at the top. I put the 100 micrograms at the bottom. All right, from here, we need to get rid of what? Our goal is milliliters per day. We want to keep milliliters, but we do not want that word microgram. So I'm going to write down MCG and I'm going to look back up here. Look, don't use that other microgram now. You've used that drug label 9 times out of 10. You use the drug label 1 time in a dose count problem. I've already used it. Do not look back at that drug label. We're done with the drug label. So looking up here, I do see micrograms, luckily. That's not going to work out as nice for us right here in a few minutes. But I do see the micrograms. I see 0.7 micrograms. Here's our double slash. How do we handle that double slash? 0.7 micrograms. The kg and the dose, I'm going to put them together at the bottom, just like I did with the previous double slash problems we looked at. So what are we going to do here? Micrograms, we got rid of them. Our goal is milliliters per day. What do we need to get rid of here? We need to get rid of kilograms and we need to get rid of dose. Which one do you get rid of first? Doesn't matter. You just got, as long as you get rid of both of them, it does not matter which one you get rid of first. I'm just going to get rid of kilograms because that's the one that's written first down here. And what I always do is I look back at my problem. Since this is pounds, I mean, yes, I know some of y'all are going to take 138 divided by 2.2. Still a funky decimal. I don't want to use funky decimals in my calculation until my final answer. So I'm just going to bring in that conversion. 1 kilogram, 2.2 pounds. Now I'm gonna go ahead and get rid of the word pounds. We got that client's weight of 138 pounds. Put that over 1. That's that one understood client. And that's going to cancel out our pounds. Now, if we stopped right here, your answer would not be correct. Our goal is milliliters per day. Right now, if we stopped right now, we would have milliliters per dose. And that's not what our goal is. We need to get rid of the word dose. And there's a couple of ways that we can go about doing this. Now, what most students, it's kind of, maybe it's about 50-50. Q12H means every 12 hours. So what some people will do is they'll say, okay, this is per dose. They're getting 1 dose every 12 hours. That is what this means. Now, some of y'all may know it's 2 doses per day. That's fine. But do y'all agree? This many, blah, 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 every 12 hours. They're getting a dose every 12 hours. Well, we're still not done because we don't want hours at the bottom. We want day at the bottom. And guess what I'm going to do? Do y'all know what I'm going to do right here? What did I do back here in red? What did I do in red right here? I did a conversion, didn't I? Well, watch. 24 hours are in a day. Hey, we're getting rid of words. We're using conversions. Hours cancel. And I bet some of y'all were like, man, I never would have thought of that. And it does take practice, especially if this is your first time looking at this technique. And look at how crazy this is. And hey, guess what? We still got two problems left. And these problems are getting progressively more challenging. So they do get a little bit more challenging than this. But look at what we've done. We got rid of all of these words that we don't want. And if we look at the end, when it's all said and done, milliliters is the only word we have left at the top. Day is the only word we have left at the bottom. We have met our goal. And remember, technically speaking, I didn't need this calculator up until right now when I've met my goal and I'm ready to calculate. Let me slide this guy on over. And what's that calculator shortcut, y'all? Multiply all of your top numbers and divide by all of your bottom numbers and press equals one time. So here we go. Got a 5, a zero point 0.7, a 138, and a 24. Goodness gracious. So let's multiply them. 5 times zero point 0.7 times 138 times 24. Now, if you want to press equals, you can. But remember, I said, hey, we can just go ahead and immediately start dividing by our bottom numbers. I'm going to divide by 100. I'm going to press divide again because there's a 2.2 down there. I'm going to press divide again because there's a 12 down there. And finally, I'm going to press equals. I don't know about y'all, but I hope you are seeing, and I mean, if this is your first time seeing this, you can't expect to get, I mean, hopefully you are, my goal is if you've never seen this before within this hour is for you to maybe kind of lean towards, hey, this technique really isn't that bad because we're doing the same thing over and over. We're establishing a goal. Starting off with that first word at the top, you get rid of words that you don't want until you've met your goal. And when you've met your goal, you multiply all of your top numbers, you divide by all of your bottom numbers. We want to round to the nearest tenth. We're finally going to bump one on up, 4.4, because that 9 tells that 3 to go up. 4.4 milliliters per day. Now, I do have a question for a student over on Zoom. I saw where that student submitted 4.4 milliliters, like over 5 minutes ago. So, question. Did you know when to multiply and when to divide, or did you do dimensional analysis? Hmm. Impressive. So, look, I got two different answers. One student said, I just multiplied and divided. They knew when to multiply versus when to divide. Not everybody can do that. And then the other student came right back after and said dimensional analysis. Now, if you want to try a formula with that, there are ways, but that formula for that problem is entirely different than the formula for this problem. And guess what? Good luck with this one. This is another problem with weight, but now we're talking about infusions. Skip all the fluff. How many milliliters per hour? So, what is our goal? And I do see, as y'all are reading over this, I do see a student that says, hey, the ratio proportion method, that will work. See if you can do it for this one. It is possible. It's just that it's not going to, it's more steps involved, honestly, in my opinion. But hey, if you're getting the problem right, if it ain't broke, don't fix it for sure. So our goal here, skipping over all the stuff, our goal is how many milliliters per hour? Milliliters, top word. See what I'm doing every time? Goal, got milliliters per hour. I'm going to start off with that top word. Where up here do we see milliliters? Boom, 500 milliliters. Now, what do we put below this 500 milliliters? You got to read into the problem. You might say, well, I don't see any other numbers beside it. It might not always be right beside it. The bag contains 400 milligrams of that medication. So in that 500 milliliters, there are 400 milligrams of medication. I know they're not beside each other. If they're not beside each other, typically they do pop up in the same sentence, but it's better to actually understand, okay, I see why these are connected. In that 500 milliliter solution, there's 400 milligrams of that drug. Now, we need to get rid of milligrams because that's not part of our goal. So I'm going to put milligrams at the top. What's the problem here? The problem is that milligrams is not in our problem. We have micrograms in our problem. What are we going to do? Don't touch that calculator. Nope. Clear it out. Don't touch it. We need to get rid of milligrams, but we have micrograms. We need to do a conversion. Now, yes or no? Is this conversion correct? Yes or no? And I ask people, it's not correct. It's not correct. I ask students quite often, I'm like, what's the conversion from micrograms and milligrams? And I very often, more times than not, the student will say 1,000. And I'm like, 1,000 what? So you have to make sure the 1,000 goes with the right number. The correct conversion, 1 milligram is 1,000 micrograms. Now we've done our conversion. We cancel out our milligrams. Now we can bring in the double slash. We can now get rid of this microgram that we've converted to with the double slash. 4 micrograms, double slash, handle it the same way. We're going to put kilograms and minutes at the bottom. Are we done? How do we know? How do we know? Look back at your goal. We need milliliters per hour. Right now, we have milliliters per kilogram per minute. We need to get rid of kilogram and we need to get rid of minute because we need just the word hour at the bottom. So it doesn't matter which word. It does not matter which word you get rid of first. I'm going to get rid of kilograms. Don't jump the gun and think that you got to convert every time. We do not have to convert here because the client's weight is already given to us in kilograms. I don't have to worry about 2.2 pounds. You don't automatically convert. You only convert when you're missing stuff. We're not missing kilograms. So kilograms cancel out. If you stopped right here, your answer would be milliliters per minute. That's not what we want. We want milliliters per hour. So guess what I'm going to do? Some of y'all might say, oh, I'm going to multiply by 60, or I'm going to divide by 60, or which one do I do? Well, let's use a conversion. Let's write down the correct conversion. We got minutes at the bottom. We need to put minutes at the top. Now, that's what cancels out those words, and make sure you put the 60 in the right spot. 60 minutes is equal to 1 hour. Do not put the 60 at the bottom. It's not 60 hours. Minutes was at the bottom. We put minutes at the top to cancel. 60 minutes is equal to 1 hour. Have we met our goal? Milliliters at the top, hours at the bottom. Boom. You're not memorizing formulas. You are memorizing conversions. And again, I said that back at the very beginning of this webinar. There's no way around it. You have to memorize your conversions. So let's proceed forward. Let's multiply one second. Let's multiply all of our top numbers. 500 times the 4 times a 60, and then times another 60. And I'm not going to press equals. If I press equals right now, I know that number is going to be big. I don't want to write down big numbers. I'm going to immediately divide by 400. I'm going to divide again by 1,000. And then there's going to be nothing else to divide by because I told you you can skip all of these ones. So dividing by 1,000, now I'm going to press equals. And hey, we actually get a pretty nice number here. No decimals, no nothing. 18 milliliters per hour. And I do see some of y'all coming in here with these answers. So, if whatever technique you're using, keep on going with it. Now, this is so we're getting ready to do the giveaway right here in a second. We have one more example that I want to cover with y'all. And for those of you that have been getting all of these right, good luck with this one. I'm not saying you're not going to, but this one is definitely, probably, quite frankly, one of the more challenging questions in dose calc. And what I call it, now, what did I call these up here? What did I call this up here? I called it the double slash. And a lot of times in weight-based calculations, you are given this double slash in your problem. But sometimes, and people say, man, my nursing instructors mean when they do this. But sometimes you have to build the double slash. What does that mean? Skip over the fluff, read the question. What is our goal? And you may say, man, you're going too fast. I understand. I mean, but look, hey, we got an hour, we got a few more minutes. Our goal, skip all this junk and read what it says. If the client weighs that many pounds, calculate the amount of medication the client is receiving in micrograms. Whoops, not milligrams. Micrograms per kilogram per minute. I call this building the double slash. We need to build the micrograms and the kilograms and the minutes. You're not given micrograms per kilogram per minute. You have to figure that out. And y'all, this one's going to be crazy. Whoops. So let's check this out. I'm going to go ahead and make some more room. So what is our goal? And I'm definitely gonna follow the chat, see if it says round to the nearest whole number, by the way. We'll see if somebody can get this right as I work through it. Let's start off with micrograms at the top of our first fraction. Look back through your problem. And the only time I see the word micrograms is right there in my goal. I don't see the word microgram getting mentioned anywhere else in my problem, but I do see the word milligram. So guess what we're going to do? We're going to convert. 1,000 micrograms is equal to 1 milligram. And again, you don't have to start off this way. Dimensional analysis, you have a lot of freedom to start however the heck you want to start, but why not start with the goal? Why not start with that top word in your goal every time? Because it always works. Yes, it takes practice, but I promise you, you can always do this. So why did we convert? We need micrograms at the top. I did not see micrograms getting mentioned anywhere in the problem, yet we do see milligrams. So we converted. We got our 1 milligram. I'm going to put the 50 milligrams that I see in my problem. And there's 50 milligrams of this sodium stuff in 200 milliliters of fluid. So 50 milligrams in 200 milliliters of fluid. Milligrams cancel. Got a long ways to go. 50 milligrams are in the 200 milliliters of fluid. We want to get rid of milliliters. Therefore, we got to bring in something. And there it is. Boom. 75 milliliters per hour. Milliliters cancel. Nice job, Miss Barker. 75 milliliters per hour. Do we want hour? And you might say, man, we got a long ways to go. Yes, we do. We need to get rid of hour. We want minutes. So I tell you what, I'm going to go ahead and handle my conversion there. I'm going to write 1 hour over 60 minutes because we can get rid of the word hour. And y'all, we're getting close. We are building this double slash. We have the micrograms. We've built that in. We have the minutes. We have built that in. Now we have to build in our kilograms. Do not get rid of either one of these yellow words, but we still need the word kilogram in our problem. And here comes this is going to feel weird, but here's how I do it. I build it. Looking at our goal, where do we need kilograms at? We need kilograms at the bottom. So I'm going to put the word kilogram at the bottom. I'm building this straight up like Legos. I want kilograms below the micrograms. I want kilograms at the bottom of my Lego stack. It is down there at the bottom. I'm building this. Now, it would be nice if this problem gave us the client's weight in kilograms, but it's given to us in pounds. And I know I said I'm not going to touch my calculator, but hey, 212 divided by 2.2, man, them ugly decimals. So I'm not going to use that. I'm going to use the conversion. I know that feels weird though, because you might say, man, you're putting this at the bottom and you're not getting rid of anything. It's the building concept. My goal shows me that I need kilograms at the bottom. So I'm literally writing the word kilograms at the bottom of a fraction. I did not see kilograms up here. I saw pounds. So I'm going to use that conversion and look at where pounds is at. Pounds is at the top. We're going to put this 212 pounds at the bottom. I know this feels weird, but the reason why I'm putting that 212 pounds at the bottom, one client at the top, because that's the only way we can get rid of pounds. We stuck the kilogram at the bottom because that's where we need it, which forced us to put this conversion of pounds at the top. So we got to put the client's weight in pounds at the bottom. They cancel out. Y'all, look at what we got here. Look at what we got here. Micrograms, only word left at the top. Kilograms and minute, sure, they're not in the same order. It don't matter. It doesn't matter. But those are the only two words that we have left at the bottom. We have met our goal. I do see a couple of y'all coming in, and the answer is 3 if you round to the nearest whole number. So those of y'all that got 3, let me know. How'd you do it? No one went to multiply and divide, ratio, proportion, dimensional analysis. Let me know. I'm curious. But as you type that in, I'm going to multiply all of my top numbers and divide by all of my bottom numbers. 1,000 times 50 times 75. Goodness gracious, this number is going to be huge. Times 2.2. But I don't care how big that top number is going to be. I'm going to immediately divide by the 200 at the bottom. I'm going to divide by the 60 at the bottom. And I'm going to divide by that 212 at the bottom. Copying all that over. And boom, there you go. Multiplying all of our top number. And y'all, look at how crazy that is. I mean, we're multiplying and dividing 1, 2, 3, 4, 5, 6, like 7 different numbers. But we're doing it all at once. We're pressing equals one time. We get our answer rounded to the nearest whole number. That means the nearest ones place. So that 2 tells the 3 to stay the same. So it's 3 micrograms per kilogram per minute. And I'm seeing feedback over there. Okay, so the three people that responded: dimensional analysis, dimensional or canceled out dimensional analysis. Now, this other student, and that's very impressive. Some students, like I said, you'll know when to multiply versus when to divide numbers. And quite frankly, if you got that problem right and you just know when to multiply and divide by a certain thing, then you got it. This is probably one of the toughest problems you would run across in a dose calc course. So that is great. But y'all, I'm gonna tell you, I mean, that one student who just knew when to multiply and divide, it's, I mean, I've been teaching for 20 years and few and far between can do that for every single problem. So it's impressive, but that's why I'm here because a lot of us need a organized approach. And quite frankly, this is coming from, I've been teaching for 20 years. This is one of the most organized ways to do any type of math problem that I've ever run across. That's why I love teaching it because it's one technique and it works for so many problems. So I hope you found that helpful. Now I know it's a little bit past the hour, but we're getting there. Y'all, go grab your phone, scan that QR code, and let me see here. And this is how you can get into the giveaway. So I know we're a little bit past the hour. I apologize, but there is like four questions. You leave your name, your email address, and some feedback. I like the feedback. It helps me improve these webinars for you all. And by you doing that, you'll also be in the giveaway. And I'm going to get that set up as I start to see these things come in. So I'm going to copy and let's see. Boom. All right, I'm gonna copy and paste this over in Zoom. That's a chat that I do have access to. I'm gonna copy and paste it over in YouTube and Facebook. I don't have access to the other chats. My apologies. But I will give you just about a minute. It shouldn't take you no longer than a minute to fill it out. We'll come back and I will see who wins. All right. So I do see quite a few coming in. I don't want to hold us up too much longer, but I will sit there. I'm still seeing quite a few. So some things to keep in mind. Be on the lookout, following us on whatever social platform you do follow us on, and that Dose Count webinar, because I did see some folks interested in attending that in June. That will be a distractor based. It'll be a lot like today, but I'll just be doing problem after problem after problem after problem. I will not be trying to talk about tutoring or, you to check out all of our nursing school courses and all of that good stuff that we have over at Archer. But I'm going to take all the names that I have right now. It's quite a few. All right, I'm going to copy and paste these over. I'm actually doing emails. I'm going to do the email addresses, but I'm not going to share those publicly. Uh, Random name picker. Let me paste those in here. All right. So now here's what you need to do. So I got the first name, Andrea. I don't know what platform you're on. I will say that you have a 94. I think there's two Andreas. You have a 94 in your email address. I think that's pretty much going to single you out. So okay, I do see you over in Zoom. Congratulations. Now you hang out for a second. Everybody else, thank you all for attending. I will see you all in an upcoming another free webinar sometime in the future. Hang out for the one in June as well, where we do distractors. You all take care. I enjoyed it. Have a good rest of your week. Give me 1 second, Andrea. I'm just going to end these streams real quick.